Thank you very much indeed, Count Corlin. Taoiseach, there are very serious revelations in today's Irish Times concerning the dysfunctionality and disconnect in the management of our health services. In particular, the correspondence between the CEO of the HSE and the Secretary-General of the Department of Health, who no doubt was doing the bidding for the Minister for Health. And essentially it was in relation to this HSE's attempts and the CEO's attempts to fill 253 vacant consultant posts across the country right now. 12% of consultant posts are now vacant, causing a real crisis in the delivery of services to our people. And looking for a restoration, he was, of the cut in 2012. And all of the correspondence reveals, Taoiseach, that the figures produced in this budget to cut health by 600 million were never real. The HSE in his letters at pains to point out that they never signed on, even though people said publicly that they did. They never signed on for these figures, or indeed for Haddington Road either, and then were expected to deliver on the figures themselves. And then we have the revelations in the Irish Times via an article from Professor Donal O'Shea that last week's decision to stop surgery for obesity in St Vincent's University Hospital and the dysfunctionality involved in that decision, which actually will cost lives. These are people who are extremely obese who need this surgery and has been stopped in Vincent's. And I thought his quotation today was very apt. He wrote that leadership is absent and chaos currently reigns. And last week we had the revelations in relation to the community mental health service, where patients are dying within the care of the HSE itself. And we had some stark revelations about that on Sunday on the This Week programme. So Taoiseach, all of it reveals, without any doubt, that morale is extremely low within our health service, that there's a complete absence of coherent management within the service itself, and that frontline services and safety of patients is at risk, particularly in the context of the vacancies across the country.
Thank you.
So many consultant posts.
Thank you.
What I want to put to you, Taoiseach, do you accept that the figures produced in last year's budget, or this year's budget, sorry, were actually false and bore no relationship to the reality of what could have been achieved by the HSE? And secondly, do you still have confidence in the capacity of the Minister for Health, James Riley, to manage our health services?
Taoiseach.
I don't accept your assertions at all. Clearly, in areas as significant as the Department of Health and the HSE, there are always going to be opportunities where differences of opinion arise, and clearly I have no idea how letters between the Secretary-General of the Department of Health and the Chief Executive of the HSE find their way into the public domain. As you're well aware, Deputy Martin, these kind of things usually have a way of finding themselves into the public domain. I'd point out to you that there are 29,000 fewer patients on trolleys last year than compared to 2011. The number of adults waiting for 8 months or more for treatment for day case surgery is down by 99%. I recall that was going to be ended way back in 2004. Consultants will now see and discharge patients 24/7, saving the state hundreds of millions of euro, an issue that was not tackled in previous years. The establishment of hospital groups is the most fundamental reform in the health service in decades. Clearly, with an average of one new primary care centre being open per month, we're moving to a point where community care and facilities in the community are of such importance. I saw the article this morning in regard to obesity. I do understand that in a number of these cases that surgery is necessary. My understanding is that there was an allocation made for 20 such operations this year, that had been gone through, as I understand it. I don't accept your assertion at all in respect of mental health services. We dealt with this yesterday. This government was the first in decades to actually remove the entire mental health service from being the Cinderella of health services and put it mainline, and have money ring-fenced for that. And I'd point out to you that the suicides that were discussed yesterday and that were mentioned yesterday, tragic though they are in every case, actually happened in the care of professionals who have been speaking out about these things. Minister Lynch has taken a particular interest in this and has been very consistent in seeing that the best services available are made available to the people who require them. Obviously, the HSE has pointed out to the Department of Health of the establishment of a reference group in order to provide support to HSE members and the management negotiation team during the LRC engagement in the context of the McGrath report, which was published, as you're aware. As I understand this, Deputy, the Department of Health will continue to work closely to implement the recommendations of the McGrath report. The current difficulties with recruitment and retention of doctors relate to a very wide-ranging and a very long-standing set of issues, and that was the context for the establishment of the Strategic Review of Medical Training and Career Structure that was chaired by Professor Brian McCrath. The review group issued 2 reports to date for Ciancórla, and the final report is expected by the end of this month. It is a fact of life, if you like, Deputy Martin, that while these things remain unresolved and we await the final report before taking further action, many of these positions are being filled through applications by agencies. Obviously, that's a higher cost on the taxpayer and on the public service. So this is an issue that needs further attention, and will receive that. The answer to your final question is yes, in respect of confidence of being able to sort this out. The issues that I've mentioned here, where serious progress has been made on issues and matters that were left lying around for years without attention, speaks for itself.
Deputy Martin. 1 minute, thank you.
Taoiseach, you might just be very more clear in terms of expressing confidence in Minister Riley. Yes, fine, thank you. Taoiseach, you might read the Mental Health Commission report that's due out today, which basically completely states the opposite of what you've been saying. The Commission is disappointed in relation to the health services. 44% of all posts are vacant across mental health hospitals and mental health care facilities. 15 million out of the 35 million ring-fence money was taken out by Minister Riley. And the whole report reads as a damning indictment of what's been going on in our mental health services. And in terms of the first question I asked you, Taoiseach, do you accept that the figures produced in last year's budget were false? You didn't reply. Because I think what the Director General is saying to the Secretary General of Health is very telling when he says that decisions made elsewhere without formal consultation with the HSE on the final proposals. And we saw that last year, and all of the problems that are happening emanate from that budget, which was back at the stamp kind of stuff in the budget negotiations that went on, and which is having very telling consequences for patients, Taoiseach. Because you mentioned 20 operations for obesity. Between Galway and Vincent's, they were doing 100 a year. As a country, we should be doing 1,000 operations in relation to extremely obese people. And you stand up here today and say 20 is good enough? These are life-saving operations, Taoiseach.
Sorry, Deputy, would you put this supplementary question over time? Thank you.
They save time and they're efficient. They're efficient because they deal with an issue and in the acute context, which then obviates and takes away a lot of the other expenses that are attached to it. You should intervene immediately on that, because
would you put your question, please?
Is correct. It reveals a telling lack of leadership within the health service. That something like that could happen.
Deputy, would you put your supplementary question, please? Thank you.
So I'm asking you, Taoiseach, do you accept the figures were false that were produced in the budget this year? And that's why we're having all of these issues across the full spectrum of the management of our health services. And will you intervene to get the obesity operations back on track at Vincent's?
Your assertion that there should be 1,000 operations a year for obesity is the politics of failure.
No, it's not my assertion, it's Professor
I'm not an expert in the requirement of surgery like Professor O'Shea is. And clearly he's making a point that there is insufficient money to do the number of operations that he thinks should be carried out. And I'm not going to quibble with the consultant's professional experience. Why should I? He's an expert in that field. But I mean, Deputy Martin, you know this well enough. We've got a challenge facing us as a nation in terms of the way and the the health initiatives that have been taken about people's management of their own lives in terms of diet, activity, and all of these things. Clearly, the consultant also points out that it does take up quite a lot of time in the management of people's activities and health initiatives and so on. The question of the number of obesity operations, surgical operations that need to be carried out is I am not in a position to determine what that level is. I'm not in a position to. The figures that were produced in this budget were always known to be challenging. I said that at the very beginning. And I've already pointed out that there will be a necessity to have a supplementary budget in 2014. And I've pointed out on more than one occasion that the major issues that have been left lying around for years that were never tackled are now being tackled, and serious progress has been made in a number of areas. Of course, it's not to everybody's satisfaction. And the Department of Health, as you know yourself, because you failed in your responsibility to deal with many of those issues, are now being tackled as part of the major initiative to get our health service right. And as we move over the next number of years towards universal health insurance, the costs and the effect and the benefit of this will be seen by everybody. This is a very broad spectrum, Deputy Martin. You want answers to every question now. These are issues that you never went near when you had responsibility for it.